Hi, my name is Renee Mann. I'm a mental health therapist at South Lane Mental Health, and I also work at the Cottage Emergency Department, and that's what I'm going to talk about today. We have a small group of 5 to 7 clinicians who are South Lane Mental Health employees who are contracted with Peacehealth to provide services to the Cottage Grove Emergency Room for all mental health emergencies. We've been doing this since 2012, and we handle all incoming populations from the very young children to elderly, anyone who walks through the door. We work with a variety of presenting concerns, from complaints of struggles with adjustment to difficult life experiences to depression, panic, substance abuse, suicidal behavior, and violent behavior. We provide counseling and intervention. We assess for the safety of individuals, including potential life-threatening harm to self or others, using research-backed tools. We work really closely with the doctors, the nurses, and other clinicians at the hospital to ensure that the patient receives the appropriate care and is safe. We also work with families and providers outside of the hospital, and any relevant support people or services in that person's life to coordinate and make sure that once the person leaves the ER, that they're cared for and supported. We also connect patients rapidly with outpatient services. So oftentimes that's at South Lane Mental Health, including substance use treatment. We offer 3 intakes a week, and that means that anybody who has been seen in the ER can oftentimes get into outpatient services with us within a couple of days. When we determine that somebody's level of risk is too high and there's not appropriate supports at home, and the services available to them are not going to keep them safe, we do have the ability to work toward psychiatric hospitalization of a patient. That's often going to happen at Peacehealth's Behavioral Health Unit in Eugene. It's formerly known as the Johnson Unit. But sometimes we do send people to other psychiatric hospitals throughout Oregon, depending on what's appropriate. So following an ER visit, somebody's gone home, we do a follow-up phone call and the next day or so to make sure that they're doing okay and see if they need any additional resources or supports. And this also helps to ensure that they are engaging in next steps, such as going to see a doctor, going to see a psychiatric medication prescriber, starting up outpatient services. Last year we had 253 visits at the ER. That's from September 2019 to September 2020. And yes, we are still providing services in the Cottage Grove ER during COVID. None of our work changed. We're still doing that work with masks on. So I want to leave you all with a technique that I like to teach patients in the ER that helps calm them down and bring their nervous system response back to normal. So this is called the 5 senses technique. And what you do is notice 5 things that you can feel, 4 things that you can see, 3 things you can hear, 2 things that you can smell, and 1 thing that you can taste. And I'll demonstrate the first part for you. So 5 things I can feel is the earbuds in my ears, hair on my neck, the shoes on my feet, the chair underneath my thighs, and the waistband of my pants. And then you continue on that with 4 things that you can see around you, 3 things you can hear, 2 things you can smell, 1 thing you can taste. And by the time you're done with that, you're oftentimes more focused on what's going on in your body rather than the racing thoughts in your mind. And maybe you have a little bit of nervous system calming going on. Thanks, everybody.